Pandemic as more people are getting vaccinated. Some experts say it's time to start moving doses to doctors' offices, not just mass vaccination sites. As KMBC 9's Alan Shope tells us tonight, that may be happening soon.
It's important to get vaccine in the hands of the primary care and specialty providers who know patients.
For that to happen, vaccination distribution researchers like Julie Schwan say
it depends a little bit on each state and each community and how fast the rollout goes in those locations.
Julie is a health systems expert. Her job to model pandemics and look at supply chains. She says as soon as the mass vaccination sites are no longer needed,
that's when I think some of the vaccine will start shifting more to doctors' offices. I think that could happen as early as this fall.
Julie working on loan to the CDC during the H1N1 distribution and rollout. She says, like other viruses, this one is not going away.
I think we're going to see two things. I think we probably will see something like the seasonal flu shot. Eventually, I think almost all adults will have had some kind of protection against this virus.
She thinks in the not too distant future, you'll be able to get the vaccine as easy as the flu shot.
I'm expecting that vaccine will be in places like pharmacies and doctors' offices on a regular basis.
In Kansas City, Alan Shope, KMBC 9 News.
Swan says the biggest challenge for pharmacies and doctors' offices will be getting the freezers to store the lower temperature vaccines. The CDC says Missouri is getting more than 320,000 doses of vaccine for the next week. Kansas will get 187,000 doses. That's an increase for both states. Both states are being resupplied with the single-shot Johnson & Johnson vaccine. Kansas now hopes to concentrate more on vaccinating the poorest and its most vulnerable.
And approach vaccination in clusters, looking to bring vaccine in mobile units, for example, to those places that are the most susceptible.
She says that would include Wyandotte and pockets of Johnson County, Kansas. Staff at Kansas City's Shepherd Center is worried older adults living at home and alone might be falling through the cracks when it comes to getting vaccinated. It is why they put out the call to see who needs help. They've heard back from more than 170 people. The group says many seniors don't have computers or family to help them sign up.
They are the most vulnerable of the vulnerable, low access, low income. We were able to get 2 clinic times that were dedicated to Kansas City Shepherd Center.
To learn more, call the Shepherd Center at the number on your screen. 150 older adults on their list have been able to find a vaccination appointment. Concerned tonight, results of AstraZeneca's U.S. vaccine trial may include outdated information. This after the drug maker announced its vaccine is 79% effective in preventing symptomatic coronavirus and 100% effective at preventing severe disease and hospitalization. AstraZeneca stands by its research, promising to provide more information in a couple of days.
And this kind of thing does, as you say, do nothing but really cast some doubt about the vaccines and maybe contribute to the hesitancy.
The vaccine isn't approved for use in the U.S. yet. The company plans to ask for FDA emergency use soon. New tonight from the Kansas City, Kansas School District, in-person learning resumes 1 week from tomorrow. March 31st will be a half day. Students can choose to stay remote. Early childhood students will begin in-person learning April 5th.